A child often wakes up feeling fine, then a few small, itchy red spots appear. Parents might think they are just bug bites, but soon, more and more spots pop up. The itch becomes much stronger and more persistent. Chickenpox has likely made its unwelcome arrival. Understanding this illness is the first step to managing it. Chickenpox is a well-known and common illness. Many children around the world experience it. Its most famous feature is a very itchy rash. This rash is made up of small blisters. These tiny blisters are filled with clear fluid. For most individuals, they will only get chickenpox once. After having it, the body usually builds immunity. This immunity protects them from getting it again. The illness is caused by the varicella-zoster virus. It is a member of the herpes virus family. Interestingly, this same virus can cause shingles later in life. Knowing about chickenpox is incredibly important for caregivers. This knowledge helps parents and guardians provide proper care. Education leads to better health outcomes for everyone involved. The varicella-zoster virus, or VZV, is the direct cause. This specific virus is responsible for chickenpox infection. VZV is remarkably efficient when it comes to spreading. It can enter a person's body quite easily. Once inside, it begins to multiply very rapidly. This quick multiplication is what leads to the illness. Understanding this virus helps us understand its spread. It is a resilient virus that travels effectively. How does this VZV actually infect a person? The virus often enters the body through the respiratory system. This happens when tiny virus particles are in the air. An unsuspecting person simply breathes these particles in. The virus can also enter the body through the eyes. Once it gets inside, it doesn't stay in one place. It travels through the bloodstream to different parts of the body. This systemic spread is what causes the widespread rash. Chickenpox is known for being extremely contagious. It spreads with remarkable ease from one person to another. Schools and daycare centers can often see rapid outbreaks. This high level of contagiousness makes control challenging. Before the telltale rash of chickenpox even appears, there can be some early warning signs. A fever might be one of the first symptoms to start. The infected person might also feel unusually tired or fatigued. A headache is another common early complaint. Some individuals, particularly children, may lose their appetite. These general symptoms can appear a day or two before any spots. The most recognizable sign of chickenpox is its distinctive rash. This itchy rash often makes its first appearance on the torso. From there, it typically spreads to the face and then the limbs. The spots can even show up inside the mouth, or they might appear on the eyelids or in the genital area. The rash begins as small, flat red bumps on the skin. These bumps quickly evolve into the characteristic blisters. The chickenpox rash progresses through several distinct stages. First, raised pink or red bumps, known as papules, appear. Second, these bumps transform into small, fluid-filled blisters. Third, the fluid-filled blisters eventually dry up and break. They then form crusts and scabs over the healing skin. Resisting the urge to scratch is crucial but very difficult. While chickenpox is often a mild illness for most healthy children, complications can sometimes occur. The skin can become infected if the blisters are scratched open. Bacteria from the fingernails or skin surface can enter these openings. This can lead to a secondary bacterial skin infection like impetigo. Pneumonia, which is an infection of the lungs, is another possibility. Pneumonia as a complication is more commonly seen in adults. It can also affect those with weakened immune systems. In some rarer instances, chickenpox can lead to more serious problems. The brain can become inflamed, a condition known as encephalitis. This is a very serious complication that requires immediate medical care. Another rare but severe risk is Reyes syndrome. This condition can affect the liver and brain, especially if aspirin is used. Toxic shock syndrome is also a rare but dangerous possibility. These conditions, though uncommon, underscore the need for vigilance. It is very important to consult a doctor if certain symptoms appear. A very high fever, or a fever that persists for many days, is a concern. If the rash unfortunately spreads into one or both of the eyes, any difficulty with breathing or a persistent worsening cough is serious. A stiff neck or a severe headache also warrants a doctor's visit. If the person seems unusually ill, very drowsy, or confused, doctors can usually diagnose chickenpox quite easily. The main way they do this is by carefully looking at the rash. When dealing with chickenpox, home care focuses on relieving symptoms. Cool baths can provide significant relief from the intense itching. Adding uncooked oatmeal or baking soda to the bathwater can help. Calamine lotion, applied directly to the spots, can also be beneficial. It helps to dry out the blisters and reduce some of the itching. It is very important to keep fingernails trimmed short. This helps to prevent skin damage and infections from scratching. Wearing loose-fitting soft cotton clothes is highly recommended. This type of clothing helps to prevent rubbing on the sensitive skin. Ensure the person with chickenpox drinks plenty of fluids. Water, diluted fruit juice, or oral rehydration solutions are good. This helps to prevent dehydration, especially if there is a fever. Adequate rest is also very important for recovery. For most healthy children, specific medical treatment is not usually needed. However, certain groups of people are at higher risk for complications. This includes newborns, adults, and those with weak immune systems. For these individuals, doctors might prescribe antiviral medication. Drugs like acyclovir can help make the illness shorter and less severe. The best way to deal with chickenpox is through prevention. The chickenpox vaccine is a safe and highly effective tool. It protects individuals from getting the illness. With appropriate care and time, the itch will eventually pass. Thanks for watching. If you learned something new, hit that like button, share this video with friends, and subscribe for more awesome, easy-to-understand science videos.